السلام عليكم. أهلا بكم. أنا د.داليا family medicine specialist. Work at Iraqi University College of Medicine, Family and Community Medicine Department. The educational package will be the antenatal care is a guide to a safe and healthy pregnancy. Please, first of all, your mic should be silent, not online. يعني راح نحتاجها خلال المحاضرة وراح أوزع لكم أوراق، يعني راح أقسمكم جدولين وهاي الأوراق راح تجاوبون على بعض النشاطات خلال المحاضرة اللي راح تكون جروب أكتيفيتي، تكتبون أسماءكم كلها وتنطونها. Training methods and tools that show laptop, smartphone, PowerPoint, question and answer, group activities, individual activities, brainstorm, role play, video, color papers and books. This is the table of the content and the distribution of time during the lecture. Scientific content of the training package. Introduction, antenatal care definition, the objective of antenatal care preventive services, risk approach, pregnancy complications, health education and advice. General objectives, providing students with the skills to deliver comprehensive health care to pregnant women. At the end of the session, the students will be able to define the antenatal care, identify the high-risk pregnant women, recognize the complications of pregnancy, list the routine investigations in pregnancy, explain the advices that should be given to the pregnant woman, apply the acquired knowledge in a role-play scenario, and generate a relevant research question about antenatal care. Each one, read this question and answer it, please. We will start from
both.
I think both.
Both.
Medicine. Each one. Both.
Listeners.
Listener.
Both.
All your answers correct. Maybe listener or speaker, according to the state. If the person requires someone to listen to him or to her, he will prefer to be a talker, but in a speaker. But if he wants to speak to someone, he will be now. Every year there are an estimated 200 million pregnancies in the world. Each of these pregnancies is at risk for an adverse outcome for the woman and her infants. While risk cannot be totally eliminated, it can be reduced through effective, affordable, and acceptable maternity care. To be most effective, health care should begin early in pregnancy and continue at regular intervals. Now, go to this video, please. After anyone can define antenatal care in a few words.
Medical care provided to the pregnant women during the period of labor.
Any other answer? It's the medical and preventive watch due to the pregnant and health people during the pregnancy. Antenatal care is a planned examination and observation of the woman from conception till the birth, or it refers to the care that is given to an expected mother from the time of conception is confirmed until the beginning of labor. Now the objectives of antenatal care are to improve the physical and mental health of women and children, to detect early and treat properly complicated conditions that could endanger the life or impair the health of the mother or the fetus, to reduce maternal and perinatal mortality and morbidity rates, and to prepare the woman for labor, lactation, and care of her infant. Lastly, to sensitize the mother on the need for family planning. Now, according to your groups, please write the name of the members of the group on the paper and answer this group actually a question. 2 minutes. Now, I will take the answer of the first group. Of the first pregnancy to the 28th week. Then from the 28th to 36 every 2 weeks. And from the 36th week every 1 week. The second group. The same answer. Ideally, the mother should attend the antenatal clinic once per month up to 28 weeks, twice per month from 28 to 36 weeks, once per week in the last month. Routine antenatal care visits should be at least 8 visits, First, during the first 12 weeks, second, 18 weeks, third, 24 weeks, fourth, 28 weeks, fifth, 32 weeks, sixth, 36 weeks, seventh, 38 weeks, and lastly, eighth visit at 40 weeks. And at any time she has a concern or health problem, the health worker will determine the next visit accordingly. Example, hypertension return in 1 week if more than 8 months pregnant, severe anemia return in 2 weeks for follow-up. Now, the most important subject in antenatal care is the preventive services, because antenatal care is mainly preventive services. Okay, therapeutic, but mainly preventive. The first visit, irrespective of when it occurs, should include the following components: history, complete history, physical examination, including general examination, vital signs, blood pressure is very important, weight, height, and BMI is very important. Ultrasound in first trimester for confirming of viability, for calculating the gestational age of the fetus, and to determine if there is a single pool or multiple pregnancy, or if the pregnancy intrauterine or ectopic pregnancy. In second trimester, useful for screening for anomalies, and in the third trimester for monitoring of out of flicker, for placenta, and position and presentation of the fetus. Laboratory investigations in the first visit should include general urine examination, complete blood count, general stool examination, serological examination, virology for hepatitis B, hepatitis C, HIV, and VDRL for syphilis, blood group and RH, and blood sugar, and we should give her folic acid supplement 400 to 800 microgram, and preferably to start with folic acid 3 months before pregnancy to prevent neural defect. Excellent. Also, subsequent visit, physical examination. Laboratory tests should include urine examination and hemoglobin, should be repeated routinely in the second and third trimester. Iron and folic acid supplementation and medication as needed. Iron and folic acid starting in the third trimester starting date, which is a capsule, ferrofolic capsule, contain 30 to 45 milligram elemental iron or plus 400 microgram folic acid. Immunization against tetanus. The schedule of tetanus toxoid vaccine will be as follows. Starting the first dose in the second trimester, the second dose after 1 month, the third dose will be after 6 months, the fourth dose after 1 year, and the final fifth dose will be after 1 year also. A group or individual instruction on nutrition, family planning, self-care, delivery, and parenthood. Referral surfaces when necessary. Now activity, individual activity. Please scan the QR and answer this question. Answer. Okay?
Okay.
Now, anyone? Answer.
Blood group and RH.
Okay. Other investigations? HP.
General
General one.
CBC.
CBC. No? Not done what random blood sugar. Any?
VDRL.
DRL. Other answer?
General
General urine. Viral screening for? Excellent. And generalist.
Yes.
Let's go. The central purpose of antenatal care is to identify high-risk cases as early as possible from the large group of antenatal mothers and arranged skilled care for them. These cases include elderly gravida, short stature, malpresentation like ridge or transverse line at 36 weeks, antepartum hemorrhage, threatened abortion, preeclampsia, anteeclampsia, anemia, twin, poly or oligohydramnion, previous stillbirth, intrauterine death, manual removal of a placenta, a grand multiparous, prolonged pregnancy 14 days after expected date of delivery, and history of previous cesarean or instrumental delivery, and lastly, pregnancy associated with chronic diseases, cardiovascular disease, kidney disease, diabetes, tuberculosis, liver disease. Now, group activity. According to your group, please answer this question. The same thing, write the names of the member of the group on the paper and give me the answer. Now take the answer of the first group.
Abortion. Abortion.
Okay.
Gestation of diabetes.
Okay. Hypertension.
Cancer.
Pregnancy complications. The most common complications in pregnancies are abortion, ectopic pregnancy, anemia, hyperemesis gravidarum, gestational and chronic hypertension, gestational and chronic DN, placenta complications, urinary tract infections, viral infections, deviant thrombosis, preeclampsia, premature uterine contraction, and preterm labor. Now, health education and advice counseling is very important in antenatal care, and a major component of antenatal care is the antenatal or prenatal advice concerning diet, drug. She shouldn't take any drug without prescription of her doctor. Avoid exposure to radiation because of teratogenicity. Counseling about warning signs or called red flags. These signs, if occur in the pregnant woman, she should go to the health facility as soon as possible, and she shouldn't wait the date of her next antenatal care visit. These signs include vaginal bleeding, convulsions, severe headache with blurred vision, fever and too weak to get out of the bed, severe abdominal pain, fast or difficult breathing, and decreased or no fetal movement. Also, counseling about breastfeeding is very important and start this counseling from pregnancy. About dental care and oral hygiene, about travel. Many pregnant women ask about travel. So we should counsel her that she should avoid traveling in the third trimester because of the risk of preterm labor. And if she wants to travel, she can travel in second trimester if there is no complication in her pregnancy. Also, the family planning. Anyone know the birth spacing? How long?
2 years.
2 years, at least 2 years, 6 months. Sexual activity, exercise, immunization. Anyone remember from the lecture the schedule of tetanus toxoid vaccine?
Second trimester. First, in the fourth month, then after 1 month, in the third month, then after 6 months, third vaccine, and fourth after 1 year, and the fifth also after 6 months.
Also, about the dietary supplement, as I mentioned, found as a first trimester and periodic in the second trimester. Pregnancy plates should include the following: protein, non-starch vegetables, whole grain legumes, and starch vegetables and fruit. She should drink a lot of water, and she should take at least 2 to 3 servings of non-fat milk, and she should take leafy green vegetables to increase her bowel movement and to avoid constipation, which is common in pregnancy. Also, she exercise 20 to 30 minutes walking, okay, and a good counseling about exercise. As a conclusion, antenatal care is crucial for ensuring the health of both mother and fetus during the pregnancy. and playing a vital role in preventing complications, promoting healthy pregnancy by providing access to health education, healthcare support, and contributing to the reduction in the maternal and infant mortality rates. Everything clear now? No answer? Any question? Now, practical training using role-play strategy. In the practical part of the session. To achieve pregnant woman has anemia, how would the doctor advise her? أنا حختار اثنين منكم طبعا. واحدة طوعون، هو لازم يعني لأنه واحدة pregnant وواحدة بيناتهم اختار الأدوار. The other members of the will evaluate the role-play scenario and assess the data. Okay. Now, pregnant woman.
احنا قلنا ان كتاب الحمل مالتنا هسه تقريبا 20 اسبوع واصلين.
تمام. Already دكتورة أنا اللي مستقبلتها مسويت لها complete examination و she noticed she's bad and she sent her to the lab to do aging. Now she returned from the lab and give her the result of the investigation and we will see how the doctor comes.
بالنسبة للهيموجلوبين جدا هي 10.5 وبالنسبة للحامل هي تعتبر نسبة قليلة. تعتبر 11 و40. احكي لي انت شو طبيعتك الهيموجلوبين؟ شنو بدك من الأكل أكل قليل من الفيتامينات الأشياء السيارات الساعة أبدأ أحطها بس بعدين سببت ألم بالبحر لذلك نازلة عندك نسبة في الدم صار عندك شوكولاتة فنصيحتي إلك إحنا حتى نساعد هذه النسبة مالت الدم ترجع إلى النسبة الطبيعية المثالية الفلوفور اللي راح أكتب شيء بس على الباصمة بالنسبة للمنطقة الصحية وأيضا تهتمين بطبيعة الغذاء مالتك ونوعيته الكمية مالته كثرين من الفواكه كثرين من الألياف حتى لا يكون عندك هذا الانزعاج اللي يصير عندك بالمعدة إن شاء الله. تمام. كملين التريتمنت مالتك تجين على الزيارة الجاية بعد أسبوع إن شاء الله حتى نعيد التقييم ونشوف نسبة الهيموجلوبين.
Now, we will assess scenario.
Excellent.
Excellent. Full mark? Why?
Which was important. Illustrates the risk factors. Complete the case.
يعني أول شيء ناخذ شنو listening and communication skills. شلون كانت؟ Good listener?
Good listening.
Good listener. Any other opinion?
Explain the status to the patients, explain the drugs and the drug visit, everything.
Very good listener. Okay? سمعتها شافت شنو الأسباب يعني فهمتها قبل لا تنطيها أي advice. فبالنسبة للlistening and communication skills تستحق جد excellent. Now, scientific clarity. Your opinion.
Excellent.
Why?
Provide the information about the risk factors of the healing.
Other question? other answer عفوا.
Severe advice. What type of guides?
She didn't give a general information, but she should provide accurate information about the risk of any during pregnancy. So, تستحق ولا ما تستحق؟ Excellent, fine. End of the activity. Why?
Provides a clear plan for the treatment.
Oh, yeah. Sure. Sure.
Explain all the needs for the patients.
The end of the activity. Sure. ليش بالقراءة؟ يعني ما قلت لها روحي خلاص هاي بالعكس أعطتها counseling وقالت لها تجيني after 2 weeks for follow up. يعني أعطتها a follow up plan with specific steps on time. صفقوا لها الدكتورة. Excellent. This is a feedback on educational package. Sorry, please scan. Okay. هاي المحاضرة راح نعطيكم تاسك بس الموضوع يستحق. A next task will be Sarah Hassan, 26-year-old prime gravida, present for her first antenatal care visit at 61. She's a school teacher with no significant medical and surgical history. Her LLP was March 15, 2025. She reports nausea and fatigue. Mention the most important investigation that should be done for her and how would you counsel her to improve the quality of her life during pregnancy. I answer counsel all the aspects in the lecture should be included. Please submit your answer to the classroom before the assignment deadline. وراح أحدد لكم طبعا الديدلاين للكلاسروم. Task 2. Suggest a research question about the antenatal care with brief discussion of the elements to be included in informed consent for conducting the research. Okay? نخاف شوية راح تقعدون بس يلا موضوع مهم. Any other question, please?
Okay. What about the postnatal care?
Postnatal care, we will discuss postnatal care in session special for postnatal care in the next lecture. Any other question? Okay, thank you for listening.